small non-dilating pupil is a common challenge for cataract surgeons. Multiple techniques have been described to address this, with the most widely used being iris hooks or pupil expansion devices such as the Malyugin ring, B-hex ring, or Gupta ring. These devices have been in use for years, offering greater safety and predictability during surgery. This video demonstrates a novel technique for managing cataracts in a small, non-dilating pupil. The approach involves creating two phaco tunnels and, after performing the capsulotomy, removing the cataract by alternately using both tunnels and switching hands. The principle behind this technique is direct accessibility of phaco fragments from diagonally opposite end, which makes it easy to hold or chop or emulsify the phaco fragments without damaging iris and/or capsule. Two tunnels in opposite half of cornea makes it possible. This technique is further enhanced by the use of the DRG chopper shield designed by Dr. Rakesh Gupta. Let's see the videos. First video is a case of complicated cataract with small pupil and posterior synechiae. We begin by creating the right-sided main tunnel and initiating the capsulotomy. After OVD injection, a 360 degrees synechialysis is performed to release the posterior synechiae. Using microforceps, the capsulotomy is completed, deliberately made slightly larger than the pupil to improve access. Hydrodissection reveals a soft cataract, which can be difficult to rotate. Here, the DRG chopper shield is used to protect the iris margin and anterior capsular edge. To improve maneuverability, a second, left-sided tunnel is created, allowing approach from the opposite quadrant. The soft lens matter is gently aspirated. Here, the DRG chopper shield is used to protect the iris margin and anterior capsular edge. Bimanual irrigation aspiration of epinucleus and cortex from both visible and hidden areas. Hydroimplantation of a foldable acrylic IOL is performed. And viscoaspiration completes the procedure. Post-operative day 1 shows a quiet eye, a well-centered IOL, and no evidence of iris trauma, capsular tear, or retained fragments. No swatch, second video. This is a case of senile miosis without posterior synechiae. After creating the main tunnel superotemporal in left eye, the anterior capsule is stained with trypan blue dye, carefully injected beneath the iris for uniform staining. Capsulotomy is performed under OVD using a 26-gauge bent cystotome, followed by hydrodissection. OVD is re-injected and the nucleus is rotated. This case features a grade 2 to 3 nuclear sclerosis, providing good rotational control. The DRG chopper shield, with its 110 degrees angled, bulb-shaped tip, is then glided under the iris and anterior capsule. The anterior tip allows ramp walk of iris and anterior capsule over the DRG chopper shield. This allows safe horizontal chopping in the invisible zone while shielding both the capsular edge and iris from damage. Nuclear fragments are removed within the central pupillary zone, ensuring the iris remains untouched. Throughout the procedure, the chopper continues to protect the anterior capsule and iris while facilitating efficient fragment removal. Once most quadrants are cleared from the left side approach, a second port is created supraronasally to access remaining fragments on the opposite left side. After epinucleus removal, bimanual irrigation aspiration clears the cortex completely. Foldable IOL is implanted under OVD. Viscoaspiration is performed, and ports are hydrated to conclude surgery. Conclusion: using two strategically placed tunnels in opposite halves of the cornea allows complete and safe cataract removal under the iris without a pupillary expansion ring, minimizing trauma and maintaining surgical control. DRG chopper shield not only performs safe horizontal chopping in invisible areas but also guards the iris, capsule, as well as manipulate nucleus and epinucleus towards Phaco tip.